Presenting treatment plans and financial arrangements to patients seems like a daunting task, especially if the patient requires lots of work. In this video, I'd like to tell you about how I approach patients with larger treatment plans and present finances by breaking up their treatment into phases. The treatment planning we learned in dental school was a great foundation from a clinical standpoint, but proper financial arrangements have to be in place for patients to accept your recommended treatment. And this is simply my take on how I've approached treatment planning and financial presentations to patients, especially if it involves multiple visits or maybe multiple specialists. So here's what we're going to cover. We're going to talk about treatment planning and presenting finances for a patient with no insurance or a fee-for-service patient. We're also going to talk about treatment planning for somebody who has insurance, whose benefits have maxed out for the rest of the year. We'll also look at an example of a patient who has self-bought insurance with fixed copays. And then we'll also cover how to use pre-made templates and then go over the free services that are available online for quick access and storage. By the way, I've also included downloadable templates that I use on a daily basis in my practice, and you can use them from reference and edit them as necessary for patients. The link to download these templates are in the description below this video, so make sure you download them and use them as necessary. If you're presenting treatment plans yourself in the operatory, or you've got someone dedicated like a treatment coordinator in your practice, you will find these templates super helpful. So let's say you've just opened the doors to your brand new office last week, and in walks in a patient who needs tons of work and actually wants to move forward with treatment ASAP. However, you've got no dedicated team member to present the finances after you've gone over the clinical importance of all the work they need. So now you as the doctor need to know how you're going to sequence the treatment and also present the cost and the financial arrangements for that treatment plan. If you're overwhelmed, it's completely normal. 8.5 years into my startup, I still present all the finances, discuss treatment plans right in the operatory. So having these pre-formed templates definitely helps. Do I present treatment and discuss financial arrangements for the entire treatment plan the same day? The answer is no, not always. At the end of the visit, I usually summarize what I've discussed and I'll break it up into phases. I give them a ballpark cost of what their entire treatment plan is going to cost, but for the next immediate phase of the treatment plan, I'll give them a pretty close estimate of what their out-of-pocket responsibility is going to be for the next few visits. And usually the appointment is maybe a couple days or a week or two away, so it gives me enough time to put together a customized treatment plan, the cost, and the financial arrangements. You want to stress the fact that you're creating this custom document for them. Patients always appreciate this because they've never had their doctor present this way. Because if they're coming from another office, they're used to having a printout of itemized codes on a treatment plan. So now when the patient comes back for the next scheduled appointment, I go ahead and present the document and I go over their treatment plan, the cost, and how the payments are to be made. So let's go ahead and look at some examples of how I've set this up and how I present treatment plans and costs. To keep it simple, I'm going to start with an example of a fee-for-service patient without having to deal with limitations of insurance. So here's a patient who needs multiple extractions and implants on upper and lower teeth. Whenever I'm dealing with treatment plans that may span multiple appointments over multiple months, I never use the printout from the practice management software. If the patient needed maybe just one implant, sure, I'd skip the template and just print it out from Open Dental. Because her chief concern was only the 2 upper teeth, I split the treatment plan into phases. And the first phase involving only the 2 upper teeth that she requested to have done first. While you're looking at this, there are a few things that you should keep in mind, no matter how large of a treatment plan it is. Always keep it simple, meaning try to keep the printouts of your treatment plans to 1 page only. You can see this is 1 page. If it's more than 1 page, it's more information than what they need to know at this point in time. Break it up into phases and have them sign off at the start of each phase. You can include a second page for payment schedule / financial arrangements only, but the treatment plan should be 1 page. Include the area of the mouth. When writing out recommended treatment on the plan, don't just list teeth numbers. They remember what you told them during the exam, where their tooth is in their mouth. Upper left, lower right, upper right, etc. Show appointment schedule with sequence and write out what to expect to have completed. Time frame is more important to them than anything. Patients just need to know when they can expect to have their teeth by. Tell them what's going to be done and when, like you see in the payment schedule. You also want to show time in between appointments. Patients tend to forget sometimes, even though you've told them at their initial appointment, they'll assume they're getting their teeth when you put in implants. They need to know that teeth go in 3 to 4 months after, and sometimes longer after having implant placed, unless of course you're doing an immediate implant followed by placement of a provisional crown. Sit with the patient and go through the printed customized treatment plan. Don't just present treatment and have them take your printout at home and expect them to understand. Get them to engage and ask questions to make sure there's no confusion. All right, let's look at another example of a patient with dental insurance. For this example, this patient's insurance is maxed out and it will renew next January. So this patient presented with a loose crown on tooth number 10. We presented with a treatment plan of having the tooth extracted due to fracture post and core and having an immediate implant placed, followed by placement of a flipper appliance and also custom abutment and an implant crown 4 months later. Now, make sure you follow your state's rule when it comes to figuring out what you can charge the patient when the insurance is maxed out. In New Jersey, according to the insurance contract, I'm still obligated to charge the insurance fee since the work that's being done falls under the category of covered procedures. For this reason, I've listed on the template the insurance fee for each procedure planned and my office fee, which is crossed out, so the patient knows how much they're saving with their insurance. So you're probably thinking, well, this is only for one tooth. Why not just have this printed from the open dental treatment plan? Because even this template shows itemized list. I did this for this specific patient. He wanted the details listed out for each procedure. It's going to depend on the patient. Some patients want all the details and some are okay with an overall idea. And because this plan was maxed out, I find it much easier and faster to just create a custom treatment plan like this, then go ahead and make adjustments in open dental for each code at the time of presenting. So in this case, I listed out my office fee, the insurance contracted fee, and what the potential reimbursement is going to be from the plan, if any. And of course, what the patient out of pocket is going to be. You may notice that the fees for the implant codes, placement, custom abutment, and crown add up to $3,301, whereas my implant fee for everything start to finish is $2,695. According to my contract, I'm obligated to charge the lesser of the two. So in this case, the start to finish fee for the patient's implant, abutment, final crown is $2,695. I've included a possible reimbursement from this plan towards the implant crown because it was confirmed at the time of his insurance verification that this patient does have benefit towards implant crown, but not for the placement. Now, since the crown is not to be seated until January, when his plan renews, he should have some reimbursement should the plan approve the predetermination that is sent out for the procedure. Now let's look at an example of a patient with a self-bought insurance plan, also referred to as an individual plan. This plan in particular had a fixed copay for procedures that the patient is responsible for. And on top of that, the plan also reimburses some amount once you send in a claim, depending on the procedure. This patient also wanted an itemized list of all procedures, an exact copay for each code. This is what I mean when I say keep your templates flexible. If you have a strict philosophy where you don't want to show any patients any detailed breakdown, you're going to face resistance, okay? Either they won't move forward with treatment or you may just simply make them angry. So I've shown you a few examples of custom treatment plans, but you're probably thinking, how can I possibly provide this at the patient's first visit? The answer is you're not going to get into the custom treatment plans, or you're not going to provide these custom treatment plans at the first visit. The first visit, you'll do a comprehensive examination, enter the recommended treatment into the patient's chart, and you'll tell them exactly what you're going to start with at their next visit, addressing their chief concern. And then when they come back for that visit, you're going to go over the custom treatment plan. At the end of the first visit, make sure you do let the patient know what their out-of-pocket is going to be the next time they come back for work, or whatever work you plan on doing at that visit, in addition to going over the custom treatment plan. So there's no surprises. So let's talk about organization. How can you keep these treatment plan templates organized so you can easily retrieve them, search for them, or edit them when you need them? Keeping these kind of custom treatment plan templates for different scenarios will definitely save you and your team's time. You can either store these templates locally in Word document format on local workstations, or you can store them online on cloud hosted services like Google Drive, Dropbox, etc. This way, they're easily accessible by anyone you want to share it with. Whether you decide to do it locally or have it hosted online, just make sure you create a folder structure of some sort. For instance, I have folders created under the main office name, Mint Dental folder on Google Drive. Under the systems folder, I've created more folders, including one for treatment plan templates. And under that, I've created folders for patients that I've generated custom templates for. After going through different scenarios of patients with specific treatment needs and financial arrangements, I simply pull up the saved template and edit the fields to speed up my process of coming up with custom treatment plans. As I said earlier in the video, I've included 5 different templates that you can use right away, and you can edit them as necessary. The link to it is in the description below this video. Once you download it, you can save each file as a separate file, and you can even upload it onto Google Drive and edit them as necessary. And that's it for today, guys. I hope this was helpful for you in understanding how to approach treatment plans that go beyond 1 or 2 visits. Don't forget to subscribe. If you found this helpful, please share with your colleagues and friends. And until next time, take care.